This video is for educational purposes only. Consult your doctor before making health decisions.
Let's begin by briefly analyzing today's title. Joint pain after 60 is a warning sign. One anti-inflammatory drink reduces stiffness 55%. The main health problem here is joint damage and chronic inflammation, which often shows up as stiffness, swelling, and pain in the knees, hips, shoulders, and hands after age 60. The promised solution is one specific anti-inflammatory drink that can significantly reduce stiffness by as much as 55% according to clinical findings. This problem is dangerous for seniors because joint degeneration is not just about discomfort. It is one of the leading causes of disability, loss of independence, falls, and even early nursing home placement. When joints deteriorate, mobility declines, muscles weaken, balance suffers, and the risk of hospitalization increases dramatically. The solution is critical because reducing inflammation early can slow cartilage breakdown, preserve mobility, and protect your independence for years. Now here is the reality. After age 60, nearly 1 in 2 adults reports chronic joint pain, and studies show that persistent inflammation can accelerate cartilage loss by up to 3% per year. That may sound small, but over 5 to 10 years, that degeneration compounds, leading to bone-on-bone friction, severe stiffness, and in many cases, joint replacement surgery. Ignoring early stiffness is one of the biggest mistakes seniors make because what feels like normal aging may actually be progressive inflammatory damage. If inflammation remains uncontrolled, it doesn't just affect your knees, it increases systemic inflammation, which is linked to heart disease, cognitive decline, and muscle loss. In other words, joint pain after 60 is not just about joints, it can be a whole body warning sign. To guide us through this, let me introduce Dr. Michael Reynolds, a board-certified rheumatologist with over 28 years of clinical experience treating more than 12,000 patients with osteoarthritis and inflammatory joint conditions. Dr. Reynolds has published peer-reviewed research on nutritional interventions for inflammation and reports that over 60% of his patients who adopted targeted anti-inflammatory nutrition strategies experienced measurable reductions in stiffness and improved mobility within 3 months. His clinical data show that small, consistent dietary changes often produce better long-term outcomes than relying solely on pain medications. So what is actually happening inside aging joints? As we age, cartilage, the smooth protective tissue covering the ends of bones, begins to thin. Synovial fluid, which lubricates joints, decreases in quality and quantity. At the same time, inflammatory molecules called cytokines increase in the bloodstream. These cytokines trigger enzymes that break down collagen, the structural protein that keeps cartilage resilient. Aging also reduces the body's ability to produce natural antioxidants, making joints more vulnerable to oxidative stress. The result is stiffness in the morning, swelling after activity, cracking sounds during movement, and pain that lingers longer than it used to. Now, let's debunk a few dangerous misconceptions. First mistake, assuming joint pain is simply wear and tear. Scientific danger, chronic low-grade inflammation accelerates cartilage erosion far beyond mechanical wear alone. A large observational study found that individuals with elevated inflammatory markers had a 35% faster progression of knee osteoarthritis compared to those with lower levels. I recall a 67-year-old patient, Robert, who believed his knee pain was just age. He delayed intervention for 5 years. By the time he sought help, imaging showed advanced cartilage loss requiring surgical consultation. Second mistake, over-relying on anti-inflammatory medications while ignoring diet. Scientific danger, long-term NSAID use can increase the risk of gastrointestinal bleeding by up to 40% in seniors and may raise cardiovascular risks. A patient named Linda, age 72, took daily pain relievers for years but never addressed inflammation at its source. Eventually, she developed stomach complications that required hospitalization. Third mistake, consuming pro-inflammatory foods without realizing it. Diets high in refined sugar and processed seed oils increase inflammatory markers significantly. One controlled study showed that high sugar intake elevated C-reactive protein levels by 20% in older adults. Now here is the core solution. One clinically supported anti-inflammatory drink that many seniors can prepare at home, tart cherry and turmeric recovery tonic. The scientific benefit lies in its key compounds, anthocyanins in tart cherries and curcumin in turmeric. Anthocyanins are powerful antioxidants shown to reduce inflammatory biomarkers and oxidative stress. Curcumin has been demonstrated in multiple randomized trials to reduce joint pain and stiffness comparable to mild anti-inflammatory medications without the same gastrointestinal risks. In one study involving adults with knee osteoarthritis, daily curcumin supplementation led to a 58% reduction in pain scores and a 55% reduction in stiffness over 8 weeks. Tart cherry extract has also been shown to decrease inflammatory markers and improve joint comfort in older adults. Together, these compounds work synergistically by inhibiting inflammatory pathways and reducing the enzymes that break down cartilage. Here is a simple action plan. Each morning or early afternoon, combine 8 ounces of unsweetened tart cherry juice with a quarter teaspoon of high-quality turmeric powder, add a pinch of black pepper to enhance curcumin absorption by up to 2,000%, and mix with warm water. Consume it consistently for at least 8 weeks. Pair this drink with adequate protein intake to support surrounding muscle and with gentle resistance exercises to stabilize joints. Hydration is essential because cartilage is nearly 80% water. Dehydration worsens stiffness. Before continuing, if you value evidence-based guidance specifically designed for adults over 60, please take a moment to like this video, subscribe to the channel, and comment below with your age and the joint that bothers you most, whether it's knees, hips, shoulders, or hands, so we can create more targeted content to support your health and longevity. Remember, this channel is dedicated to helping seniors protect their independence through science-backed strategies. Now imagine waking up with less stiffness, walking without hesitation, climbing stairs with confidence, and playing with your grandchildren without fear of pain. Reducing inflammation today means protecting mobility tomorrow. It means fewer doctor visits, lower medication costs, and a reduced risk of surgery. It means preserving your independence and dignity. Joint pain after 60 is not something to ignore, but it is also not something you are powerless against. With the right nutritional strategy, consistent habits, and early action, you can slow degeneration and regain control. Take this warning sign seriously, start the anti-inflammatory drink consistently, and commit to small daily improvements. Your joints support every step you take. Protect them now so they can support you for decades to come. Subscribe for more medically grounded strategies to stay strong, mobile, and independent well into your 70s, 80s, and beyond.